So the next thing that we're going to talk about in the acronym Doctors ABCD is defibrillation. Now this is an actual defibrillator that we have here at the college. They come in all shapes and sizes. All of them are basically have the same format of use, and all of them usually talk you through the process of what you need to do to help a person. So inside the Defib machine we have the actual defibrillation monitor here. So it's as simple as opening the lid. It will turn itself on and it will show you how...
Stay calm. Follow these voice instructions. Make sure 000 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. When patient's chest and torso are exposed, remove square foil package from lid of AED. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner.
I might actually show that on the fake one now.
Tear open package and remove pads. Tear open package and remove pads. Tear open package and remove pads. Peel one pad from plastic liner. Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest. Place one pad on bare upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock. Stand clear. Push flashing button to shock delivered. It is now safe to touch the patient. Give 30 compressions. Then give 2 breaths. Start CPR.
Okay, so basically the defibrillator will talk you through the stages that you need to go. It is a bit repetitive. It feels a little bit slow in a high-packed adrenaline situation, but it's also good, it calms you and reminds you step by step of what you need to do. As I'd mentioned, most defibrillators that are out in the community in that are very similar in terms of what they require you to do, and that they will talk you through what you need to do. I'll show you here with the defibrillator pads. On an adult, we're placing the pads on the upper right chest and the lower left axilla or armpit. We're doing this because when we're doing defibrillation, we're actually wanting to pass a current through the heart to shock it back into a rhythm that will sustain life. So we're actually wanting the current to pass through the heart. So if you think of the heart being here in the chest cavity, we're placing the pads either side of where the heart would be so that the current can go through. You would do similar sort of positioning of the pads on a child of 1 to 8 years old, but on a baby, because of their anatomy is so much smaller, you would do it front and back of their chest so that it passes through their heart from front to back. With children, we do have paediatric pads in the kits, which are slightly smaller, just because their anatomy is smaller. With the defibrillation kits, they also come with a little preparation kit as well, which I will show you now. So in the bottom of the defibrillator kit, you'll have a zippered section with a whole heap of equipment in it. You have what's called a ready kit, which will have various equipment in it to help you prepare the patient for defibrillation. So you have gloves, you have some razors for shaving the chest, you have a little towel and some gauze there for wiping the chest down, more gloves, a face mask for respirations, and also a pair of scissors. So what you're going to be needing these various things for is when a person's having a heart attack, often they get a bit sweaty and clammy. So you're needing to have a dry, hair-free surface for the pads to stick to. So you would be using the towels and the gauze to wipe the chest before you push the pads on. So say for example, we've got Fred here, he's very hairy and very sweaty with his heart attack. So I'd be wiping down the areas where the pads are needing to go, there as well. And if he's got quite a lot of hair there, I would be shaving the area just where the pads are going and flicking off all the loose hairs before putting the pad on. If for some reason you can't get access to the person to do CPR, there's scissors in here that you may need to cut their clothes so that you can expose their chest to be able to get the pads on. Okay, I think that's it for that little. You'll also find in the kit at the bottom of the defib a roll of tape. Some people have nipple piercings, etc. like that, that if you have the time and are able to, it's good to cover them with tape. Just because an electrical current is going to be running through the person's chest, you want to try and prevent burns to the skin with an electrical current contacting metal. If you don't have time to put the tape on, a small burn on the person's skin is something that we can manage after the event and is of no enormous concern. Also in the kit, as I'd mentioned, we have the paediatric or child-sized defibrillator pads. Like with the other ones, you just rip them open, they plug into the machine, and you use them on a child or an infant instead of the larger electrode pads. Okay, I'm going to talk just briefly after, we've gone through our doctor's ABC. We're going to talk just quickly now about the chain of survival. Now, the chain of survival, contrary to popular belief, is not rescue yourself first, then rescue the person who bought you a coffee this morning. We're talking about providing the best possible outcome for the casualty. So it's the sequence of events that need to occur so that you obtain the best outcome possible for this person to maintain their life, basically. So we're looking at getting help really quickly and really early. Dialing 000, getting an ambulance on the way ASAP is vital in terms of getting the level of care that they will need to sustain their life. Starting CPR early and efficiently gives them the best chance of recovery after the incidents. Defibrillating them as quickly and as early as possible will also help to get their heart back into the rhythm that they need to potentially maintain their own life. Now, these are the three things that you can do as a first aider. The next one, advanced life support, is where the ambulance officers and the medical team at the hospital come into play. Once they get into the scenario and the chain of survival and that, the sooner that happens, the better the person's outcome will be. And as I had mentioned, any attempt at CPR is better than no attempt at all. Try your absolute best, do what you can. Remember that any attempt at CPR is better than no attempt at all. Anything that you can do to help the casualty is going to give them much better chance at survival. Okay, now to wrap up all that you've learnt this morning, it's really important to follow through after the event with some stress management. As I had mentioned, during an event where you're providing After providing first aid in an emergency situation, it's always important to follow up afterwards with some stress management. As I had mentioned earlier, you are going to be having an enormous amount of adrenaline running through your system during the event. Post-event, that adrenaline is going to leave your body very quickly and leave you quite flat. Bearing this in mind, you may experience some side effects of that rapid reduction in adrenaline, where you may feel a bit anxious or depressed. You may not sleep very well afterwards. You may be reliving the event over and over in your head again. You may have experienced mood swings, etc., where you're feeling quite happy and on top of things, and then all of a sudden your mood plummets a bit. It's really important, if you're experiencing any of these, that you speak to somebody, whether that be a counsellor, your local GP, other people that were involved in the event. So to wrap it all up, Fred, Vanessa and myself would like to say thank you for participating in this cardiopulmonary resuscitation training program. We hope it's been of value to you and that you never have to use it in the future. All the very best. Thank you and goodbye.